Welcome to the Call Here Sam podcast. I'm your host. My name is Sam. If you're new here, welcome. Don't forget to hit that subscribe button. Don't forget to tell your friends and your family to get onto the Call Here Sam page. Today we're talking about postpartum depression, but we're going to break it up into parts. So make sure you tune into this episode because this one you don't want to miss out on. So we all know babies bring about a lot of emotions: joy, sadness, tears. But overall, babies are just the cutest thing ever. So today, to help me break it down, I'm talking to Dr. Mwengwe Merai and Bwalya. He's going to help us. He's going to play the guy side who's going to be like, what? I didn't even know what that was. That existed? I didn't know. Yes, it exists. Welcome, guys. How are you feeling?
Fine.
How are you doing?
What? I didn't know that existed. Oh, sorry, not this part.
No.
Okay, sorry.
Now you know it exists.
I'm good. Mm-hmm. One of the reasons I'm here is because the last time I came on this podcast, the number,
we talked about it.
I got
briefly.
more followers on Instagram. Yeah.
You got more followers on
Yeah.
Instagram? That's me.
Yeah, so,
I did that.
so I'm back to just... I'm joking. I'm really interested in this topic. It's something that, as a father-to-be, something that I want to make sure that I've got on lock.
You have some information on it.
Exactly.
Okay. So today it's like I said, it's in parts. So we are going to start with postpartum psychosis. So please explain to us what that is, because I think that's the part I'm not familiar with.
Okay.
Yes.
Good morning, everyone. So basically, postpartum or puerperal psychosis is one of the three postpartum psychiatric conditions that women go through after they deliver. They usually occur within 6 weeks post-delivery. So we have postpartum blues or baby blues, commonly known as baby blues. This is most, like 80% of women go through this.
80.
85,
Does that include
80,
here as well, Zambia?
That's worldwide.
Okay.
Zambia's statistics are not well known because we don't really report these things.
I was about to say, why aren't they well known?
So we don't have the specific statistics as of Zambia. But there's in the general population, we're at 85, 90, like most women after delivery go through. So this is just basically the low mood that a woman gets to go through because of the changes that are happening. Like you're not sure of what is happening. You don't know how to go about it, taking care of this little person who seems so fragile. Like you're new at this thing, so you don't really know what you're supposed to do.
Yes.
But usually this one wears out within 2 to 3 weeks.
Okay.
And there's basically no treatment for it.
Okay.
All you need is just family support, support from your spouse, from good friends, and eventually it just goes away. You get that mom hype, that instinct just kicks, and then you know how to, like, once you know how to go about it, then we have the moderate form, which is postpartum depression. This one, they have this intense feeling of sadness, fear, anxiety. They don't really know what is happening. You just have this fear, like, or you don't know what is. You just have this low mood. You can't really take care of yourself. You can't really take care of your child. They usually even neglect their children themselves.
Yes.
And some will even have thoughts of harming their own children. Or killing themselves. And then there's the worst form, which is usually an emergency. That's the postpartum psychosis or puerperal psychosis. And then in these could be depression. They'll be depressed mixed with psychosis, where they'll have hallucinations. They'll have this abnormal behavior. They may even harm themselves. Just this abnormal behavior.
So how can you tell when someone has postpartum psychosis? What are the first signs?
For most, they'll start, because it's gradual in onset, they'll start with this low mood. For others, it just has this abrupt onset where there's all this, but in most cases it has gradual. They'll start with this low mood, then this abnormal behavior, then the worst form, they'll be seeing things.
Wow.
Yeah.
Just a question there from the boys for the psychosis, because it sounds so extreme. Is there ways of detecting it even before labor? Surely there must be some form of signs, because labor is already difficult. So you'd think that it may trigger the psychosis.
Yeah.
Is there such cases, or is that a thing, or you can't know until after?
There are those people, like usually postpartum psychosis occurs in people that maybe have a background of a psychiatric condition, or have had a history of psychosis in previous pregnancies. So in those that at high risk, you can take precautions. You know that this may happen, but it's not 100% that if you had it even in the next pregnancy, you're not going to have it. For some, they may start showing signs during pregnancy, especially if you're having a traumatic pregnancy, because sometimes trauma may begin during pregnancy. You're having maybe this financial constraint, or maybe you've lost a loved one. You're just having this just dynamic change that has really put you off. So the triggers may start then, but for most it occurs after delivery.
So when, because obviously I was asking you behind the scenes saying how can you really know it's under control once they leave the hospital, once moms leave the hospital? Do you I don't know if you try
follow up,
like do you do a follow-up? Do you, when they come back, or do you ask them to come back?
So
first of all, do we have medical personnel that visit homes? No. Because I know because I know you're good, and people come from in the comments say it's not the UK, it's not the US. No. But in the UK, when you have your baby, they actually come.
Yes.
They come home with you to make sure you're taking care of yourself and the baby, and making sure that you're okay. But
we don't have such,
or we don't have the capacity?
No, I think so.
It's the numbers. The patient to doctor
you
ratio is not equivalent. We have less doctors, less medical personnel as compared to the patients that we're caring for. So, and then our health system is limited to just within the hospital setting.
I think culture plays a role. I think once the delivery is done and all that, it's now time for the family, the extended family, to come in. So I think at that point they should have it under control, right? Because we're already thinking, when we have a kid, obviously the first couple weeks we're going to be at the in-laws' house. We haven't even asked them.
you
just
assume.
And I think because of that, our extended family, the way we're, there for each other, everyone seems to have a role.
Yes.
I think that's what makes that unnecessary, maybe.
Oh, okay.
But maybe in Europe and that,
it's necessary?
I think so, because those people might just be left to themselves.
Oh, yes. Well,
so there's
true.
more of it's something that I'm sure they're more intentional about.
Okay, I suppose that makes sense when you put it like that. But I still think even just one medical.
So for the follow-ups, we do them at 6 days first. So
6 days, okay.
They are not following you. We are not following you in your home.
No.
You follow us at the clinic, at the hospital, where we review. You see how you're doing. 6 days post-delivery. Then the next visit will be at 6 weeks. That is towards the end of your puerperium.
Okay.
Then you are,
So
by then we expect most of these hormonal changes that had occurred during pregnancy, most of them should settle by then.
Okay. So have you experienced the psychotic depression episode or episodes in moms?
Apart from being a doctor, I'm a mom.
Yes.
I'm a mom of one.
She's a mom!
Yeah. My little girl is 1 year 7. Yeah. Her name is Njai.
Hi, Njai.
Yeah. So when I experienced the blues, not the depression, and so that was, for me, the whole trigger was just not knowing how to take care of this baby, because my mom would do a better job. I felt like my mom was doing a better job, and I didn't deserve my daughter. Like, I just didn't know. Like, I was so pathetic. So I just had this patheticness. Sometimes I would cry, and then I had these medical complications that came after I delivered.
Yeah.
Because at some point I remember telling the father of my child that I think I'm dying. So that fear of dying, not knowing how my child would be taken care of,
and who's going to,
sent me into this low mood. But I had a very supportive family. Shout out to my mom. She's very supportive. She's still here with me, helping me, taking care of that little one. Then even the father of my child is very supportive, was very supportive. Then I even had good friends, very good friends, to the extent that, you know, when I was delivering, one of them was actually sick. She was sick, but she left her sick bed to come and receive my child.
Wow.
Even when I was discharged,
That's
they were
a
there,
friend.
hyping me,
wow,
like just giving me this support. So because
if you don't have friends like that,
Mm-hmm.
you need to revisit.
yeah, you need to.
Yeah. So at this point where you're feeling the blues, there's no joy of having the baby that you've longed for?
You
Or
have
does
the
it
joy.
overshadow that?
You have the joy, but you're just scared. Like, you're just feeling pathetic that you can't do what you're supposed
What you're
to.
meant to do
Because
as
you know
a woman,
you had
yes,
it
as a
all
mom.
planned out when you're pregnant.
Okay.
Like, okay, you're seeing these things on social media. You're seeing how these mothers are taking care of the baby.
Oh,
and then
they are
you're-
lying.
And then you're failing to do those things. So you have
Yeah.
this, so you just feel inadequate
Okay.
with the blues. You're just feeling inadequate. So that makes you tearful. That makes
I
you
know that.
feel
Yeah.
sad, but you are happy that you have this soul. But
Yes.
eventually, with support, these feelings were of, you know, that okay, I am a good mom. I am capable, and I am doing a good job. Because even up to now, one of my friends hypes me up. Mwengwe, you are a good mom. Right now she's not around, she's in the UK, but she calls me. Today I just wanted to tell you,
You're a
you
good
are
mom.
doing a great
I
job.
love that.
So yeah.
And moms need that. Like, when we feel like we're just inadequate, we need that. We need to hear that. We need to hear that.
I'm
Yeah.
starting to.
We
Even
need
from
to hear,
your
we need to hear that.
partners.
Yes, from your
Yes.
partners, from your friends, from your family. We need to hear that.
So, what I'm starting to see here is there's a link between a woman's need for attention and validation and how well she handles her postpartum phase.
Okay.
Because, let me put it this way, right? In a relationship, women come up with things, right? To when the partner is not quite doing what he's meant to. Maybe he's having late
carefully.
nights. Yeah, having late nights, and then a woman would pretend maybe to be sick just to, you know. So women go to such lengths to get attention, right? I'm wondering how much of this could be cured by attention. So, for instance, what I'm trying to say is the way she explained hers. Because if she was getting that validation, and if she was nailing it, and if she was the starring as being a mother, right?
So you
If
think she wouldn't have gone through the
not
blues?
as bad. So I'm right now. What I've learned is, if I'm giving my wife lots of attention, lots of validation,
That's how a woman
then she
requires,
won't
actually.
get
No, but what
the
these
blues.
are,
It's a simple issue.
Please,
Guys,
no.
we figured it out.
Explain.
This is the end of the podcast.
we figured it out. All women need is attention. Then
That's
they will
all.
never go through postpartum
That's all.
depression.
Because when
Sir.
you give birth, you don't. The attention is going elsewhere, right?
No, but
How
even,
much of the blues is because
Even-
you're not the main focus anymore? None of it?
even women in
in stable relationships where they do, because it's not only the attention
Okay.
that we're talking about. There are a lot of things that can trigger. You know, sometimes you have this financial constraint, so you're
Okay.
worried, am I providing enough for this child?
Okay.
Or you had a traumatic childhood, so you have this fear, you have this worry, will my child be able to go through this? So you have this
Yeah.
fear going around in you, developing in you. So it's not all about attention, but the support can come from even church, from friends around. They'll offer the support. They'll tell you, no, it's not me just offering a word to you. It's not all it's not guaranteed that if bad things happened to me, they're going to happen to your child as well.
Fair
so
enough.
just that assurance, that word, you have this fear. Sometimes all you need is talking to someone. It's not all the time that you have to be on medication for something. Just talking to someone, assuring you. It doesn't mean, oh, my partner just giving me this vibe. No. Even from your mom, just saying, it's not always. We are here to support you. Even if death happened, I am here. You get? Because it's not all about attention. There are so many triggers. It could be financial, or because you had a traumatic, or because maybe you had a traumatic birth. You're scared. Oh, look at this person. Remember, because it's more like, a PTSD, post-traumatic
stress disorder.
You have this trauma, and then you're just like, oh my goodness, you're worried. You start thinking, you put these ideas in your head, and then they begin. So all you need to do is talk to someone, because even counseling, psychosocial education, it's all about talking to someone so that you get to see clearly what is there. Because sometimes your thinking is distorted because of worry and anxiety.
So your support system really helped you out of the blues.
Yes.
If they weren't there, could you have gone into the depression, the next phase?
Possible. Yeah.
So it's not always about it.
Okay.
Bwalya.
And then for the
It's okay,
rest,
it's fair
for
enough. It's fair enough. You're asking questions. We like it.
For depression, I haven't really come across a person, but in my line of work, I've come across patients that have gone into puerperal psychosis. And those, they are usually dramatic here, there, but all we encourage is support, and then we put them on medication, and eventually they get better. Follow up, our system.
Our system.
They are handed over to psychiatry that takes up the whole thing, the whole management plan for them. On the obstetrician side, I don't think we've really followed up this patient to see but we do recommend you write in the antenatal card when they're going, so that you know that these are risk patients that needs to be evaluated in the next pregnancy.
Interesting. So now I'm thinking, if they're being passed on to psychiatry, right? Psychiatry is broad enough to be able to handle, because this person is obviously not being the parent they're supposed to be, and because you guys, the specialists in that area of the baby, are handing that over. In psychiatry, does it cover that part?
They have different subspecialties.
Okay. I see.
So the patient you told us about behind the scenes, saying she had a
puerperal psychosis.
Yes, the psychosis, and you're saying she's okay. There's medication. First of all, I did not even know there was medication for this.
There is medication.
I didn't,
because you have to put them on. There's a variety of medications. So you put them on mood stabilizers. If they are seeing things, there are different drugs that you can put them on, so that it's because remember, this is coming as a result of whatever changes happen during pregnancy. So when you deliver, when you're pregnant, there's a rise in certain hormones. There's a rise in certain hormones, and then after you deliver, these hormones begin to go down. So during this change, those that are at risk will develop these conditions. So they'll put you on mood stabilizers so that everything goes back. Your physiological changes, everything that went abnormally, that reacted abnormally to the changes in the hormones, stabilize. Then you're good to go.
So during pregnancy, obviously you're saying these changes are happening and all that's going on. So there's no one really to tell you this is what's going to happen. Maybe expect you to go through these things. Why though? Like, why isn't it there?
That's not there in antenatal? Then what do you people do there?
For the entire 9 months.
For the entire 9 months. What are we doing there? What are we doing?
That's longer than marriage classes, huh?
Really?
No, it is actually. Because if I can recall from our classes, it was just, oh, make sure the baby's okay, feed them the right things at this stage, do this, do that. Under 5, come for under 5 jabs, whatever. Oh, and there was also a part where they said, oh, don't forget to please your husband.
This is Africa.
And
we need to know.
she didn't want to do it.
No, but
Why is it okay? Listen, the fact that came up during the classes, I found that a bit like So at the end of it all, it's just it'll come back to the man.
Yeah.
because I think that's how, unfortunately, that's how culture
Our
wires
culture
us.
is built.
That because if you can summarize the woman's teachings in one word, or in one sentence.
Please the man.
Please the man. Unfortunately, that's how it is. So I think every program that's set up after that in that
Should.
country, which involves the man and the woman, should have to have that as the main aim until that changes culturally.
Yeah.
Yeah.
Well, yeah. Well, that's a whole other different topic. We need to cover that at some point.
Yeah.
But during, like I was saying, antenatal classes, that was never discussed.
So our system, ideally, we are supposed to prepare women for these things.
But that was not-
our antenatal does not cover. Some midwives may touch here and there, but we don't broadly or go into details discussing the blues, the depression, or even the possibility of psychosis.
Okay.
Our main focus is on the dangers of that may occur to a pregnant woman. So that's women need to look out for. The
Okay.
bleeding, the signs of labor, then how to take care of that infant when the baby is there, and what you were told to take care of the man, as he has rightly put it. So I think we need to put this word out there.
We do.
Because I don't think that a need has been recognized, because this topic, looking at our culture and spiritual,
Oh yes, I was about to come to that
our
saying.
spirituality, we don't really come out to talk about these things. We women are told to be strong. Even if I went to a friend, or I'm feeling like this, they're going to shun me. They're going to tell me off and say, oh no, you're being a weakling. So we're afraid to come out. So if many women can come out, I think need will be seen so that we prevent this thing from happening in future.
I agree.
But you said when you touched on the spiritual part, the patient that has experienced the psychotic thing, you had the family members saying, "Oh, this is bullsh.
Yes.
It's spiritual. I cast it out in Jesus' name. Amen."
Exactly.
I don't know. Why do we?
I think mainly
Is it okay? Lack of the knowledge
and then we are,
we just
for
don't
lack
believe
of
it.
a better term, there's some form of we're brainwashed as Africans.
I was
Sorry
about to
to
say
use that
ignorant
term.
at some point. At
Because
some
we
point.
get to forget even things that are there.
That's
We
true.
always think this is
Spiritual.
It can be an illness.
Yeah.
So even when I go out there that I'm depressed, I'm going to say I'm a weakling, because culture, they say Africans never get depressed.
We never get sick. Why should we? It's
Yeah.
almost like we should be superhuman.
Exactly. And even if I'm going to present with hallucinations, irrelevant talking, that abnormal behavior,
Then
nape no either nape
Yeah,
na
yeah,
oh
yeah.
na bamloa.
Banko Bwalya.
Jealous. It's always that.
Yeah.
But we forget that there are illnesses. There are these illnesses that can just come naturally apart from this witchcraft, the whole thing. Psychiatric conditions are illnesses as well, and that's where we are lagging. Like, we're so behind concerning this. We're always thinking, oh, bulosh. We forget that this could be an illness.
And it is.
Yeah, it is.
It is an illness.
But I think now is the time for this to start gathering some momentum, because if you've noticed, there is a movement in the world. The people that used to be in the minority, that never had the voice, are now getting it.
Yeah.
Because I think it's absolutely necessary. Because right now, imagine how unfair it is for you to go through all these things and then and seek help and be squashed down being told you're being a weak.
Weakling.
And that's what
you're a weak woman.
Yeah.
You think you're the only person that's ever given birth.
Exactly.
All animals are doing it all the time. They're not complaining. Your cousin in the village has 12 kids. What, she doesn't even have a job. But she's managing to cook, clean, what all that type of stuff.
Oh God.
They'll make it seem like your situation or your issue is small.
Trying to minimize
and then that's it. And I don't think you'd ever speak out again.
You can't.
And that's...
No.
Yeah.
They'll make you feel as though you are trying to seek attention, like you're just an attention seeker, like you think you're the only one who's more important.
And they just don't understand.
And then they you know what, one thing we forget, we experience trauma differently.
Yeah.
Labor
that
is
needs
traumatic.
to be put out there. Yep.
Labor
it doesn't
is
matter
traumatic.
whether it's natural or C-section.
Exactly.
It's still traumatic.
Whether Caesar or natural birth, the one top normal birth. It's
because
traumatic.
you'll have people telling you, oh, but you what they just cut you up.
Exactly.
You're fine. It's not that serious. And besides, you probably don't even have that. That's why you didn't have that bond, because you didn't. Oh,
really?
You know what the concept
will
out
tell
there?
you that.
If you had a C-section, you're not woman.
Yes, you're not woman.
You are lazy. There are women who refuse. You know, you've made a diagnosis. You know that this woman won't be able to push.
Yeah.
A Caesar needs to be done.
Oh wow.
She would decline because
crazy.
mother-in-law or her mom or the pastor has said.
So
even Caesar sometimes, the pastor needs to pray. So there's all this, there are all these sayings out there. You're not woman enough if you're going to undergo a Caesar. Not knowing someone has been in labor for 2 days in pain. You have not slept, because one of the triggers for these psychiatric conditions is lack of sleep.
Really?
Your mind just gets tired, meaning abnormal chemicals begin to be released in your body, and then they trigger these emotions. You begin to see things, or your mood just goes low and low and low, and you tip into depression. You are not sleeping. And then this is one thing we forget. You know, when you deliver, this infant comes with a lot of responsibilities. You don't know why they are crying. They're just
you
there.
have to figure it out.
And you're up and then they're telling you need to sleep when the baby is sleeping. Dude, this child is sleeping during the afternoon, and I have to take care of my man as well.
I have to cook.
I have to cook. I have to clean. Worse off if you've even got a toddler or other children. You end up neglecting those other ones. So in the pressure of now trying to keep up, you don't want to be called a weakling and everything, all your emotions just now takes you into that roller coaster, and you are
amazing. And you said something that's crazy. You go from pregnancy, and then you give birth, right? Like that. Obviously, the process is slightly longer for some people. But then what I mean is, the moment the child comes out, you become a mother and have to be a mother.
Yes.
It's not like you then, now let me just recover from pregnancy for 3 weeks.
There's no chance.
Let me go and leave.
From there, you just need to figure it out.
It's like you go for an interview and you start the job immediately.
Exactly. There's nothing like, internships, they get nothing. You just have to know. You wake up, you need to learn how to bath that child. So if your mother is there, they've looked after babies before. She'll be there, she'll teach you, this is how we bath the baby. You take turns in looking after. So your husbands are encouraged. Because you can't be the only one up. Because sometimes a baby may be up at midnight, midnight
till 05.
You are just there, they are just crying. You try this, you put them on the boob, they're not sucking. Sometimes there's even, you are not able to produce enough. Like in my case, that was even the other thing.
I developed mastitis. Oh, Lord Jesus.
Would you like to elaborate for us?
Ha!
It's just infection.
Yes, and then it was clot.
Oh, yeah.
Infection of the breast.
Ah.
Inflammation and all.
Oh, okay. We'll
But
touch
for
on it
me,
some other
I
time.
was not producing enough
Next
milk.
week's episode?
Yeah.
Oh, that's like one about experience, right? Next week. Okay, fine.
Yeah. For me, I wasn't producing enough milk.
So at that point, it's adding to you feeling like a failure.
Feeling inadequate.
Yeah. And then the other thing we need to make mention, in as much as we are saying we're limiting these psychiatric, postpartum psychiatric conditions to 6 months, there are some who it can go on, they can even develop it months or
Yeah.
even up to 2 years.
Really?
Yes. So like in my case, I had this baby, I'm failing to produce enough milk. So we had this schedule where I could give formula during the day so that I'm able to make enough milk for her to breastfeed at night because she would decline. And there was this routine. And then because I was in school specializing in obstetrics and gynecology, I wasn't entitled to maternity leave. So I was called back to work early. And then my child did, like I felt rejected.
Yeah.
There was this point, like, you know, where you put her on the boob, she doesn't want, she chooses formula over you. So that period also, I felt this rejection. Like, I would feel so bad.
Wow.
Yeah.
And that was like months after I had delivered. Should have been like this 2 months after I delivered.
Yeah.
2 to
That's
3
so
months.
early. Nice.
That is
So my
early.
baby stopped breastfeeding at like 2 months.
Ooh.
She was just on formula throughout until
Wow.
early this year.
Really?
It's like she just practically
Just
rejected.
said-
So I had this, I'm like, oh my goodness, I have been rejected by my own child. Then you go to your friend and oh no, I'm able to
Express
just
milk is
express
just
milk.
there,
For
like,
me,
it's
when
just-
I express, I bought a I tried, no, you try I had an electric pump.
Oh, yes.
I'm like, it's
I
not
had the
doing
manual
job.
pump.
Yeah.
Yeah.
No, try the manual. I bought actually still have them. I have an electric pump. I have a manual pump.
The manual
I
pump is
would-
horrible, isn't it? I don't like it.
Yeah, I would produce this much.
Oh, that's
And then what do? I need to go, like, there are days when I have to be at work for longer.
for longer
Yeah.
hours.
Yeah. On cold days, I'll have to knock off maybe 18. Sometimes if it's busy, I would get to knock off 19, 20.
Yeah.
And then I only left this much of milk.
No, that's not
So
enough.
she got used to the formula
Formula.
and just rejected me. I used to feel bad. And then you're trying to soothe her when she's crying.
Yeah.
She can't stop. But when mom just gets her, she has this calmness.
Wow.
It's
I just
grandma.
like, oh my goodness.
It's
I'm
grandma.
a terrible mother. Like, why can't I be a natural? Like,
A natural
why?
one. Just let it
Yes.
just naturally
Yeah.
flow.
And you have your friend who's telling you, oh no, me this.
Yeah.
They've been breastfeeding for 7 months. Like, oh, me milk, just, I'm just like, okay, like, what happened to my boobs? Like, even up to now, I just say my boobs are useless. Like, I would just say they're useless.
Well,
Not produce anything, guys.
well. I can't say I can. Yeah, I'm feeling your pain, but I know. No, I don't.
It's crazy. So
don't relate.
and how much do the physical changes play a role in the blues or what then could become depression?
Your body changes. It's
Okay.
not your body.
Like, it's so
it's-
drastic.
yes.
Yeah.
Oh my goodness. I don't even want to think
don't wanna talk about the weight
my
gain. God.
changes. Okay, the weight gain, because okay, yes, I gained, because anyway, I
Yeah.
was throwing up. Oh my goodness.
Yeah.
Yeah.
I had a very traumatic first trimester.
Oh, that was
and
me too.
throwing up and
Terrible.
I was just surviving on IV fluids. Then I gained at some point. But because I am petite,
Petite.
Yes, yes, yes.
the
weight gain was
wasn't
not-
so pronounced.
Oh, it was pronounced in us.
Everyone thinks I didn't gain, but I did. Because I remember when I was booking, I was actually I was underweight.
Oh.
I was underweight because I threw up so much
Wow.
to the point where I was weighing less than 40 kgs when I went to book for my antenatal. Like, it was that bad.
Wow.
And then by the time I was delivering, I was almost 80 kgs.
Okay.
But
Okay.
the other contributing factor is that my legs used to swell so much, so bad. So I was close to that. And
Yeah.
there were all these skin changes.
Oh yes, no, don't forget the skin changes. The postpartum hair loss.
For me,
was it pre-part or whatever? Yeah, that thing.
Peripartum.
Before
For
the
me,
hair loss,
I had hair loss
hair.
during pregnancy. And
Yeah.
then after, I always have a full head. I've always had hair. But during pregnancy, oh my goodness, I just felt.
Yeah, like you get patches like.
Yeah,
like my hair
like
would
a
fall
yeah.
off. My hair would fall off. So I ended up locking my hair.
Really?
So I did dreads the time I was pregnant. Locking my hair just to help preserve, because my hair would come out.
Yeah.
But after I delivered, the bulkiness
came back.
Okay, but for
But
some
I have
people,
a friend, though, for her, she had a full head
That's what
during
I wanted
pregnancy.
to-
And then
It's different.
after she delivered,
Yeah.
oh my goodness,
That was
the
me.
entire front
That
just
was me.
went.
because I hear the vitamins help with, like, the vitamins you take during pregnancy.
Oh,
Yeah, they help with
I
like
hated taking
hair
those.
and
I hated taking.
yeah, because you commit to them every single day.
Yes,
like,
and it
it's
just
like-
made me feel like I was
Commitment is
sick.
a problem, though.
So maybe my head was just like, yeah, you're sick. Keep taking. It's true. Mind
Yeah.
over matter.
So do all these things, then what's the relationship like between the mother and the child when your body is changed? You're feeling all these different.
You ruined my body.
Yeah, and that
Yeah.
could even send you into depression.
Yeah.
But if you have this support, everyone is like, no, don't worry about it. You'll get back to your normal self. You have 6 weeks to heal. Because I remember I would be mocked. Hey, your stomach is still big. Guys, I just delivered
Had a
3 days
baby.
ago.
Okay.
You expect my tummy to be flat?
People are so
So
insensitive.
if your emotions are not that stable, that can tip you into depression, because everyone is busy talking to you about, oh, your body, you're still fat, oh, your stomach is so big, oh, your tummy, and it takes time for the tummy to go away. You have to really put in effort. And then there's all this concept that, oh, you can't do waist training when you've had a Caesar. You can't. Yes. And then you find that most of these women, they're post Caesars, they have this tummy even 5 months after.
Yeah.
But once the wound is healed, you're comfortable, you can start your minimal waist training. Eventually you can even start your exercises so that you lose that weight.
I see.
And that can even tip you into depression. Even after months later, you're just uncomfortable with yourself, because there are all these negative words, negative vibes that are coming from the people around you. They're always telling you, oh, you're too fat. So imagine if you know that, yes, you can't get back to you can never go back to you what you used to be 100%, like that slender self. There's always, even when you do these exercises, there's always that
little fupa.
Yes, that is going to be there. But if you have a supportive partner who's like, oh, you're looking good, you're looking great, you can do this, you're not going to tip into that. He's supportive, but ngefi I'm losing and go weight. It's you're going to start seeing yourself less. You start thinking less of yourself. Your emotions, your self-esteem just
drops.
And once you have low self-esteem, your emotions are not in place. You're just going to go into depression with just a little trauma or a little trigger. Maybe just one thing comes in and then it triggers you.
Interesting.
I miss my pre-fit city body, by the way.
Oh, I think next week. Question: women who harm babies or kill them, do you understand? Like, is it one of those?
Before I didn't understand, now I do.
Well, like, okay, because there's a part of the population that thinks, why would someone even think like that?
Yeah.
Because you are okay, but
would you?
When they are sick, they don't have the mind, they don't have the feelings, the thoughts that you're having. For them, that natural thing, that protect, naturally,
natural
as
instinct,
mothers,
yes.
The natural instinct, yes, is to protect. Even when you go in the animal world, you know that when you try to harm even birds, chickens, the mother will be there for you, like it will be there. But you are sick. This is one thing that we forget. We're not seeing depression as an illness. So that's why we are able to say that. But if we can view it as an illness, we know that this person is sick. That's why they're not able to think the way I am thinking. They are not having the natural thoughts.
Yeah.
Because it's like they feel like, oh, okay, this person ruined me, or this person is better off dead, because they won't be able to be taken care of if you have this fear. Because one other feature that is pronounced in those that are depressed is they are scared. They have this fear that something bad is going to happen to that child.
Oh,
So
I see what you mean. Yes.
If I left this child, maybe they've started having thoughts of suicide. If I die and bad things are going to happen, or probably maybe they had a traumatic childhood, someone maybe abused them, they start thinking, oh, maybe this child is better off.
Yes, not here.
Even here.
Yeah.
Let me kill myself and kill this child as well.
Wow.
Quickly, before we go, prevention
So for prevention,
for psychotic...
this psychiatric, postpartum psychiatric, like we've discussed, antenatally will be the best way to prevent. We talk to women about these things, so that they are aware. Awareness is key. If they are aware, they'll be able to report and avoid the dangers and the complications that may come across. Putting the word out there. So educating these women antenatally, so that those that are at high risk, remember family history, those that have had a history before, or those that have an underlying psychiatric condition, we know that those are at high risk. If they're educated, they know they can be sent to they go for psychoeducation, so that they know how to handle stress. Because usually it's not always that it's going to happen. Stressful events are going to trigger these conditions. So if high risk, educating high risk women so that they know how to handle stress. Even first time moms, they're educated about this topic, about the things they need to look out for, and creating a system in the hospital where someone can openly talk to them, where they're not mocked.
Yes.
And building a strong supportive system.
Yes.
So if you know about these things, you're going to talk to your partner about it.
Yeah.
You talk to your friends, so that they know when this baby, as we are preparing for the arrival of the baby, because we forget. Mostly we look at the material things, we prepare for the material things.
Yes.
We forget about the emotional things
yes.
that we are going to go through. The roller coaster that is going to
that
come
is coming,
after,
yes.
the changes that are going to come.
Yeah.
In as much, we also need not forget the men. So postpartum depression can also occur in men. So remember, you're told not to forget about your man.
Yeah.
In as much as you are caring for this little one, you need to know that there's this partner also who has nothing. He's never been a dad before. He doesn't know what to do.
Yes.
So we try as much as possible to include them so that they know. So fathers need to take an active role in going for antenatal with mothers so that they are taught, they are educated. We need to put this word out there, because even them, they are danger. They can
get in.
So one of the things that we need to look out for in men that are, and we may not know it, for some they may have this low mood, and others will just have this impulsiveness. They begin to go into risk behavior, or they have this anger. You're not knowing that this person is depressed because they don't know what to do.
Yes.
Or this financial stability is not there. They don't know how they're going to care for you
and the baby.
One that has come across. So even fathers, we include fathers in it, educate them, encourage them, and create a system that even after as their mothers are attending postnatal, these features are looked out for in these women, so that they can talk to someone. Yes, we have counselors that you can talk to. But
we do?
Yes,
oh God, I was not even aware of that.
Incorporate this into postnatal and antenatal.
I know people probably watch this and think, oh, she has such little faith in the medical system. Well, I do. No, but it's
if we can recognize the problem.
For me, it's just it's the recognition, like you said, it's the education behind it. There's literally nothing. Women don't have a safe space. Black women just don't have a safe space.
Exactly.
We are not educated. We are not told it's okay, you are not a bad mother. We are not told, we are being told this is for white women. Black women don't go through this. So it's just we just need that awareness.
We just
Doc,
need that
because
awareness.
we see when we go to the hospitals, we see these posters. Oh, prevent TB.
Yes, exactly.
What is it? Chicken pox, black pox.
Yeah, they will tell you,
red
oh,
pox.
bleeding.
Oh, yes. But we don't see
this. If you haven't
how
felt
are
your
you
baby
today, Mom? Can we see that?
Exactly.
How is Mom today?
Mm-hmm.
Can we see postpartum depression?
Exactly.
So anyway. So I know. I appreciate you so much for watching. Please don't forget to hit the comment section. Let us know what you think. I'll see you soon on the Call the Sam podcast. Don't forget to hit that subscribe button. Thank you so much for coming, guys. Thank you.
Absolute pleasure. Thanks.